And we are live. Hi, good evening, everybody. Welcome to She Built It Boss Lady Chronicles. I am Sharita Gaskins-Tillett. I am your host, and this is the show where we feature the amazing stories of high-achieving women who are owning their power to transform their lives. So I am super excited about tonight's guest. I'm looking forward to learning more about her and introducing her to you guys. But I want to give a couple of minutes for folks to log on. If you are watching us live, please say hi in the comments. Put your questions in the comments. If you're watching the replay, hashtag replay, I still encourage you to put your questions in the comments because I'm happy to forward them on to our guest. So before we get started, I also want to let you know that registration is open for a weekend for me, the Premier Wellness Experience for Professional Women, and it is taking place in Grand Cayman, October 2nd through October 5th. So you can get more information at www.aweekendforme.com. Also, you could send me a DM or email or anything like that. So without further ado, I am going to introduce tonight's guest. So I have joining me tonight Dr. Gloria Esoimeme. She is a distinguished internal medicine physician with a master's in global health and a PhD in health services policy and management. With a deep commitment to patient care, she specializes in managing chronic diseases and conducts research on physician-patient relationships to enhance healthcare outcomes. Beyond medicine, Dr. Esoimeme is a sought-after keynote speaker and coach, empowering professional women to negotiate salaries, improve work conditions, gain recognition, and achieve work-life balance. Through her expertise, she equips women with the tools to advocate for their worth and thrive in their careers. Welcome, Dr. Gloria.
Thank you for having me.
Thank you for coming. So I usually like to start by just having you, get a little bit about your background. Tell me about your journey through medicine, and then we'll transition over to talk about the coaching work because I'm really interested in that as well.
Okay. So when people ask me this question, the first thing I tell them is I was born in Nigeria. I was raised in Nigeria. I did my med school in Nigeria. So I'm very Nigerian. And I say that just so you know some of the foundations that have guided me, my thought process, how I became who I am, because I strongly believe that where we grow up, our society, it kind of influences who we are with time.
Absolutely.
So I just like to put that out there. But for my training, I moved to the US in 2011. I love public health, and so I went to BU for my master's in global health. Had an amazing time there, and then I moved to University of South Carolina for my PhD in health services policy and management. And then from there, I went on for my residency because I had done my medical school in Nigeria. And then after the master's and the PhD, I did my training at UAB. And then that was how I think I completed the foundation of all of my all of my official training.
Okay. All right. And so why internal medicine in particular?
You know what? I really loved pediatrics. Like right from when I was in medical school, I thought give me like 20 years ago, I thought I'll be taking care of babies. But when I started my research, I knew, because I deal with physician patients. That's my area. Communication is my area, negotiation. And I realized that for my research to have weight, I had to deal with adult patients. Like
Ah,
children would not really give me that
right.
experience. I wanted
Right.
all of my career to be tied together. So I pivoted to internal medicine, and no regrets.
Okay, so now you say you wanted your career to all tie together. So
Correct.
how does this now tie into, the work that you're doing in the coaching space? So now, I guess let's back up a little bit. So you are still in clinical medicine as well?
I am.
Okay, all right. So how does this new piece, this coaching piece, tie in?
Any physician, you know, how would I describe it? Once you exist on earth, you negotiate.
Okay, elaborate. Elaborate.
I will. So let me give you an example. So let's say for something that's just very common with internal medicine, I have my patient who is 45 years and above. I'm like, I need you to have a colon cancer screening. And the negotiation is it goes on different levels. It goes
It
from
does.
those who say nope, and then I'm negotiating. I'm like, please, you need to have it. This is why, and they tell me no, and we keep going back and forth. I have patients that we've been doing this for like 3-4 years. We're still negotiating, and then there are some who would go, oh, I want Cologuard. Some would say, I don't want the colonoscopy, and then we go back and forth. So that's what we do. And then with my research, that's the real core part, is shared decision making. It's still the same
Mhm.
thing, where
Okay.
I research how physicians actually empower patients to participate in decisions about their health. So it's all tied together. It's the same skill set. Negotiation has a common thread. It's just that there are different stakes at different levels, but it's still the same principle.
Yeah, it does. It sounds like an extension of the same thing. So
Correct.
now, what makes you? I'm going to assume that if you're training other women to be negotiators and to advocate for themselves, that you are a master negotiator. So, what makes you a master negotiator, and why do you think so many women in particular struggle with this skill?
Okay, so your question has different layers.
It does.
So I'll tell you, I'm not going to tell you why I am, but I'll tell you what I've achieved, and then you tell me if I am a master negotiator.
Okay. Okay.
So my current job, I work. I love where I'm not. I work for a hospital system, and I love where I work. It's a big blessing to me. I work 3 days a week, and I have full salary, full benefits. I was able to negotiate that. Am I badass or not? You tell me.
Okay.
And I'll tell you something else. When I moved to this country in 2011, I came with $250. That was all I had. And
Oh,
now,
wow.
yes, and I came in. I said, "Oh, I'm going to have a master's. I'm going to have a PhD, and I'm going to do my residency." And I was on a visiting visa, but I was able to go through the process. I have my U.S. citizenship. I have real estate that's in 7 figures. I had masters and a PhD. I have no student loans. I was able to achieve that through grace and mercy and skills that I applied.
Okay, so I'm going to tell you, you told me to tell you what, whether or not you were a master negotiator. I would say you probably are. And I'm going to tell you some of the things I heard. So you
Mhm.
said you came to this country with $250, and somehow out of coming with $250, you managed to get a master's degree, a PhD, do a residency, build a seven-figure real estate portfolio, and negotiate a full-time salary working 3 days a week. So yes,
Correct.
you are a master negotiator. The other thing I hear though is that you must know your worth and your value, number one. And number two, you must be able to communicate it. So talk to me about that. How is it that you were able to get these things? Because, it's one thing to feel a certain way about yourself, to
Mhm.
know that you have a certain, to feel that self-esteem and that worth. But how do you go about communicating that in such a way that you are able to get the things that you desire?
So the first thing I would say is, you talked about knowing your worth and all of that, but much more importantly, be yourself.
Mm,
So I don't, when I go to ask for what I want, when I go to negotiate, I don't act like I'm this buff guy. I wear a suit. No, I'm a sweet person. So I go with who I am. I would talk, and I would smile, and I would laugh, and I would be myself. And but one thing I know is, when I am going to negotiate, I know what I'm going to ask for, and I'm not easily distracted. Even though we're talking and laughing, and I know what I want, and I've gone through the whole process. I'm like, okay, this is what I want. Okay, so what am I bringing to the table? So what am I offering this person in exchange for what I want? I'm not a selfish person. And I feel like, through negotiation, when you're done, the two people should be happy.
yes.
I
Yeah.
was talking to one of my mentees this afternoon. She was telling me about a deal. I'm like, it didn't sound right to me. She got what she wanted, but I'm like, but you've closed the door to negotiation because she believes the other person too much.
Uh, uh-huh. But I think that's kind of what I'm asking you though, because you say it's not about worth, it's about being who you are. But I
Correct.
think it is about worth though. I'm going to challenge you
No,
on this.
no,
I think
it
I think
is
it is
about worth.
about worth because you go in, like you said, you know what you're bringing to the table. And it sounds like you don't back down so much from that. Now, there's negotiation, but what happens when you get a no? How do you approach that, and how are you communicating to them your worth and your value?
So there are different, every situation is different. So if you are a fresh grad and you are negotiating, your worth is that you've been trained. They don't know you, they don't know your work ethics, they don't know, they know nothing about you. So at that point, your worth is your resume and how well, even if you can communicate whatever, well, we don't know you. So at that point, what you need to know is know what your market value is out there. And then you can say, as maybe as an internal medicine doctor, you're going out to go get a job, you can say, this is my benchmark, I'm not going to go below this. And then you start that, then you go from there. But when you've worked in a place where they know you, they know what you bring to the table, then it's a different ball game entirely.
Sure.
And then you can start to argue and negotiate and say, hey, XYZ time, this is what I did, these are the metrics I hit. So because of that, I can bring this. And it's not just I did that, it's what I did that, and this is what I can do for you.
Right. So it sounds like too that you do a good job of tracking, because that's one of the things that I hear sometimes, that people say that they don't track their accomplishments. Maybe they're not writing down the things that they do, and you can't necessarily count on your employer to be paying attention. So yeah. So that's so again.
Your employer is not paying. If your employer, they do, I'll tell you, they do. They track you. They track you, and they would use you for free.
Right.
They know, oh, this is a great worker. If I call her, she's not gonna say no. And so they would use you. So they track you. But then no one's gonna call you and say, hey, come take more money. Hey,
Right.
come take a few days. They track you more than you know, because they know all their employees and they know what they all bring to the table. So if you are underperforming, they would know you are.
Right.
And so they track you.
Well, I guess what I'm saying is, but it's like you said, nobody's going to call you and offer you more money. Then yeah, they might know that you have a valuable skill set that you're bringing to their organization. But as far as being able to get more money, I think it's up to us as individuals to actually track, our contributions.
Yeah.
Um, to,
And you know the sad thing about women is that even though we are, even when we are well skilled, we always undervalue ourselves.
yeah,
You say, oh, I need to have this, I need to be perfect. And guys who are half qualified as you are, they blow their trumpet so loud.
yeah, yeah.
They blow it so loud, and women were like, oh well, I'm not good enough yet, I just need to learn this more. I just need to, I had there was a lady who I was coaching when she was in residency, and she kept saying, I don't think I'm good enough yet. I'm like, okay, so why do you think you're not good enough? She said, oh no, I need to be able to do this procedure, do that procedure. And I said, you know what you're asking for? This is 10 years work experience.
Mm-hmm.
So she felt she was not good enough because she didn't have what experience she could gather in 10 years.
Yes.
Meanwhile, a guy, I remember when I was in residency, there was a guy who, in his second year, he already got his job.
Wow.
Meanwhile, all the girls were like, "Oh, I need to learn how to intubate with my eyes closed. I need to learn
Right.
how to put a central line when I turn my back. So that's when I'm good enough." So that's the difference. Women,
Right.
we undervalue our skill sets.
Yeah, I actually think I remember hearing a statistic that men will apply for a job having 60% of the listed qualifications, but a woman will not apply for that same job until she has close to 100% of the
Correct. Oh,
qualifications. So they're
yes.
always willing to put them, kind of throw their hats in the ring, where we feel, this need for perfection
Correct.
almost. And so how do you work with your clients that have that kind of perspective, that feel like they are not yet perfect? How do you help them to see their value where they are, and to just kind of go for it?
It's a mind game, you know. It's so the first thing you do is say, okay, so what is expected from you at this stage? Are you meeting all the goals? Are you hitting all the numbers that you're supposed to? And then the next thing is, I say, so if it's someone who is, so let's say someone is applying for like a leadership position, I'm like, okay, so what does this role entail? And they say it entails XYZ. And you could say, do you think you can do this? Oh yeah, I think I can. Do you think you can do this? Oh yeah, I think I can. Okay, do you think I don't think I can do that? So what do you need to do so you can do this? What who do you need to talk to? What books do you need to read? What training do you need to get? You don't need to have all the skill set. You can get it as you move along. So it's all a mind game. It's just opening their eyes so they can see. And then sometimes I use my own experience and use experiences of other people just so they know that they have it in them. Even if, and some, you don't have to be perfect.
Right.
You don't have to be perfect.
Absolutely. So you bring up a good point about role models. I like to talk about role models because I think it is important that you see someone else doing something, that it inspires you to be able to do that same thing. So I wonder, who were your role models, and who did you see negotiate? Who did you see put themselves out there in that way?
Hmm. Let me answer your question in a different way. Maybe not the answer you're expecting. So I'm from a really large family. So I have like four big sisters and like big sisters who tell me what to do up till now, and I do it. I have to. And so when I was younger, I was the one who they would say, "Okay, Gloria, go ask."
Mm,
Oh, we want to go out to do stuff. Okay,
okay,
go ask. So from when I was little, I just kept
I
asking
see.
and asking, and my dad was, he just sharpened the skill. Like it was a case of, daddy says you can go through the door, we'll see if we can go through the window. Or like I remember I was going for a wedding and my dad was just out, I'm like, okay, daddy, I need money for an outfit, I need money for this. And he said, okay, I'll give you money for this, I'm not going to give you for that. And we kept going back and forth. So I learned that, and I was like a voracious reader when I was younger. I would read and read, and I still read now, but I was just hungry for knowledge, hungry for wisdom. So I would just read and read and read. But it was just something that I I was through my sisters threw me into the deep end of negotiation, and my dad was just this tough person who would, for whatever you needed, you had to give him a reason why.
I see. So basically you were groomed as the family negotiator.
I was. I was.
Okay. So now, what made you want to start doing this work? So I know you say your research had to do with patient and physician communication. How did you begin to do work in the coaching space, and with professional women in particular? I know we talked a little bit about, some of the ways that women feel the need to be perfect, but what really drew you to this particular area?
I think it drew me to that area because I saw so many women just changing themselves.
Hmm.
I remember I had this friend. She was a friend. She actually was a friend's friend. She was applying for a position and she had applied, was declined, and she brought it. And then our mutual friend asked her to reach out to me, and we went through. I'm like, I think we should add this to your application. She was like, no. I'm like,
Hmm.
we should. Let's put that in there. And then we did. I said, okay, go back and write this and bring it back. And when she brought it back, she was a different person. She even added more. I was like, good, good, good.
Ah,
And then she got what she was applying for. And it's just something I'm like, oh, so without me, this lady would not have achieved what she achieved at this point. Maybe she could have, but at that point she had issues, and she came to me and I helped her. And then I had friends who I was mentoring for free. Like I was just like, okay, you're going through this. I'm like, okay, let's do this, and then they get results. So then I'm like, okay, number one, I have the passion to help and I have the skill set to help. So why not do it at a bigger scale?
Right, right. And I think too, that you help them uncover things about themselves that are there, but maybe they don't readily identify.
Correct. Correct.
Yeah, and that's so important because a lot of times, I was talking to a fellow physician recently, and I was saying how actually I was doing a coaching call with one of my clients. That's what it was, and she was saying, and I was saying that we don't recognize our own greatness because it's just normal for us, right?
You're right.
So so you've done all these things, you've accomplished all these things, but it's just normal. It's just who you are, but not understanding that there's really it's really remarkable the things that you've done and the contributions that you've made, but sometimes it's really hard to see it. So, I thank you for helping women to see the greatness that is inside of them.
Yes, I think now, just getting older and wiser, my success is yours is mine.
Yeah.
So that's how I see it. Like if any woman succeeds, I am succeeding. If any woman fails, I am failing. So we're all in this together. So it's me. So when you win, I win. When I win, you win. So that's just how I see it.
So in my work, a lot of times I recognize that a lot of women, professional women, don't know what they want. So you're helping them to negotiate, so that they can get a better work-life balance and get the salary that they deserve and all of those things. But how do you help them uncover what they want?
That's a little bit tough, because if you don't know what you want, that's where it starts from. So maybe if I say I get in my car, I don't know where I'm going, then the
Right.
first, yes, we could ask, okay, are you content with where you are? And if you're not, because if you're talking to me in the first place, it means you're not content
Right.
with who you
Exactly.
are, right?
Exactly.
And so if you're not content, then what are you not content about? Is it, if it's a doctor, are you not, if it's, are you not content with your practice? Is it that you don't like seeing patients? Because that happens. Like we go through training and we think, oh, this is it, and then when you start, you're like,
Right.
so so it's like, is this what, are you happy with? If you're not happy with that, then we can start thinking of other things, and and then go from there. Or, yeah, I like what I want. Okay, do you want more leadership where you are? Do you feel better? Do you think that will make you feel more fulfilled? You start to ask questions. The more questions we ask, then we begin to uncover. But it's a lot, I'll be honest with you, it's a lot easier when people know where they want to go. Then
Right.
it's easier to direct them. But
Oh,
when you don't know, we would have to ask questions and ask questions until we dig into. And then you sometimes people have to look back to when they were little. Like, what did you really want in life?
yes.
What do you want? Sometimes we stop dreaming. Sometimes we just get into the groove of life, and then we forget what we really wanted as children.
No, you're absolutely right. And that's actually, well, or you may not know because we don't know each other that well. My, this show or my business is called Boss Lady Dream Builders. And that's what it's about. It's about women embracing their dreams because you're absolutely right. Women, well, not just women, people, I think, stop dreaming, especially once we hit adulthood. We don't think about dreams. We just do.
We just
You go to school, get a job and you just do whatever the job requires until it's time to retire. And then maybe you might think about a dream. But but I think we shortchange ourselves when we don't. It's like a whole part of you that you're not acknowledging
correct.
when you put just bury your dreams or don't even think about your dreams. I'm a believer that everybody is born on purpose for a purpose, and I think that those dreams that are inside of us will guide us to our purpose. But when we ignore the dream or just don't even acknowledge the dream, then I think it keeps us from getting to where we're meant to be.
Correct. Because sometimes you just, like you said, we just do, like and some people do not ever stop. they just keep doing
Yeah.
until they work, and then they retire and they're like, it's too late, and then that's just it. So
Yeah.
yeah,
Yeah.
it's even
Absolutely.
some people get lucky, like right from when they're young, they just pursue those dreams and they just go for it. And then some find it later in life, and then some do not ever find it, which is really sad.
Yeah, but that's why I think it's so important that people take time for themselves to actually connect with themselves and ask, what do I want? What do I want my life to look like? What are my hopes and my dreams, my aspirations? Before too much time passes, and to
That's
reassess, because you can always change direction.
right. And some people feel like they cannot stop, because if you have responsibilities, you have bills to pay, you have kids, you just keep going and going and going. However, if you take that time off to find out who you really are, you're going to have much more to serve your family. You're going to have
Yeah,
much more to serve the world. So it's kind of like a lie that you can't take time off. You can you can
right.
take time off to find yourself.
Well, it's important. It's an investment, right? It's an investment in yourself, but like you said, it's also, it is an investment for your family and those people connected to you, and even your job. So
Correct.
now, getting back to the negotiation piece, how do you help people to rebuttal or to handle no? So if you're negotiating and they say no, how do you prepare women for that? Because a lot of times it's like you had to work up your nerve in the first place to ask. Asking is hard, and so now you've asked and you've been told no. How do you overcome that no? Do you do role play with them? How does this work?
So it's more like, it's not necessarily role play. It's kind of like, maybe it's role play, but it's kind of like looking at all the things that could happen. So if you reach out to someone, there's a high chance they're going to say no to you, but that hasn't taken anything away from you. They just said no. You
Yeah.
didn't lose anything, right? It's just your ego, and
Yes.
they just said no. They didn't take the cash from you. They didn't take your current job. They didn't take anything. All they just said was no. And then, but what I tell people that I coach is that leave that conversation open. No today, maybe a yes tomorrow. And then because you've played out all the different scenarios, like, okay, so if I ask for this and they say no, then I can tell them I'm going to give them this, and they say no, I can say, okay, I'll ask for this. And if they say no, and then I could say, maybe we can visit this some other time. Or you can ask, what do I need to do to get a yes? So
Okay.
don't yeah, so there are different ways. It depends on what you're asking for. So you can ask, what do I need to do to get that yes? Then that gives you room, and then you don't say, oh, they say that it should be if they tell you stuff, it has to be specific, and there has to be a time frame. It's not like, oh, we need you to achieve this, and then you come back in 6 months, they're like, oh, we're not ready yet. No,
Yeah.
there has to be a time frame for it.
Yeah. And you brought up a really good point before when you talked about the fact that you're not losing anything. And I
No.
think that's where so much of the fear comes from, because it's like it does feel like you're losing something. I mean, maybe it's just losing, saving face or feeling embarrassed or whatever to be told no. But you're right, you're not losing anything. You have the job, you still have the job, you still have the money, you still have whatever standing in the community. You didn't lose anything, and so you have nothing. There's nothing to lose and everything to gain by
Correct.
negotiating.
You're right.
Yeah. So now, where do you see this? Well, tell me about, how does your coaching work? Are you doing one-on-one? Are you doing group coaching? How does it work?
So currently I am doing one-on-one. That's the model I have, but I'm planning on changing how things go in the next few months.
Okay. And where do you see the business going, in say 5 years?
Oh, I like that. This has been recorded. We'll come back and say in 5 years. In 5 years, I hope that I would have so much testimonies about women who have been able to speak to and coach, that they are owning their power. They are being all of themselves. They're not leaving anything on the table, and even if they leave anything on the table, they're getting something else that they're leaving that table. That's my dream, that there will be so many, there'll be hundreds of women who would say, because I was able to they'll say I was able to help them achieve that, to become good negotiators.
Excellent. So now women are interested in working with you. Where can they find you?
They can reach out to me on LinkedIn. I'm more formal on LinkedIn. I'm on Facebook and Instagram, but I have like bikini pictures on Instagram and Facebook. But my more like they can reach me, and if they could reach me on LinkedIn, they could reach me on Facebook or Instagram. I'll respond.
Okay. All right. And I usually like to end on a variation of the same question. And so I guess my question for you would be, if there is a woman who is really interested in broadening her horizons, she really wants to go for a new position, maybe a leadership position in her organization, but she is feeling unsure about her qualifications, and maybe doesn't have that the courage and the certainty so much, about it. What is the single best thing you would recommend she do to begin to prepare for the application and the negotiation?
I would ask her to apply, even if she doesn't feel qualified. She still hasn't lost anything.
Yeah. No,
I feel
you're
and then
absolutely
and
right.
then if they say no, ask why. And then when they tell her why, then she can ask, what do I need to do to get there? So I would say apply. The guy
Okay.
next door would apply.
Yes, you absolutely would apply. And then I guess the next, and yeah, I said that was the last question, but I lied. The next thing I'm wondering though is, why is this so important? Why is it important that we learn this art of negotiation?
You see, so many people are not happy where they work because they feel they're getting the short end of the stick. I love where I work. Like, I remember telling one of my friends, "Oh, I love my employer." They just looked at me like I was crazy, but I do, because they give me like whatever I've asked for. They've given it to me, so why won't I be happy with them? So that's when you negotiate and you get what you want. You feel valued, and it just makes you have that satisfaction at work. You know what you bring to the, you've been appreciated. So
Yeah.
it just makes you happy at work.
Okay. And probably by extension, happier everywhere else too.
Yes.
Yeah. So improves your quality of life.
100%.
Excellent. I love it. Well, thank you so much for coming on tonight and for sharing with us. We're going to put all of Dr. Gloria's information in the comments and the show notes. So, reach out to her if you are needing to negotiate, or you just wanting to build that skill set for when the time comes for you to negotiate for your next opportunity. Because, it's important that we learn to see our greatness, and that we embrace our greatness, so that we can do more, contribute more to the world, but also to improve the quality of our own lives. So thank you for joining us this evening, and I will see you all next week. Take care. And thanks again, Dr. Gloria.
Thanks for having me.